Joint pain is one of the most common issues faced by millions of people worldwide. Whether it's due to aging, injury, or chronic conditions like arthritis, the discomfort can be debilitating. The good news is that there are vitamins that can help alleviate joint pain and even support the repair of damaged joints. In this video, we dive into the top 3 vitamins that actually work to repair painful joints and improve mobility. When dealing with joint pain, many people turn to over-the-counter painkillers or anti-inflammatory medications. While these can provide temporary relief, they often come with side effects and do little to address the root cause of the pain. This is where vitamins come into play. Certain vitamins work by reducing inflammation, supporting cartilage regeneration, and improving overall joint health, providing long-term benefits. The first vitamin that stands out when it comes to joint repair is vitamin D. Often referred to as the sunshine vitamin, vitamin D is crucial for maintaining healthy bones and joints. It helps the body absorb calcium, a mineral essential for bone density. Studies show that people with low levels of vitamin D are more likely to experience joint pain, especially in the knees and hips. Vitamin D also plays a role in modulating the immune system, which can help reduce inflammation in autoimmune conditions like rheumatoid arthritis. But how do you get enough vitamin D? While sunlight exposure is a natural way to boost your levels, it can be challenging for older adults or those living in less sunny regions. Foods such as fatty fish like salmon and mackerel, fortified dairy products, and eggs can help increase vitamin D intake. However, for those who struggle to meet their daily requirements, a high-quality vitamin D supplement may be necessary. Health experts recommend a daily intake of 600 to 800 IU for most adults, though some may require higher doses based on their health conditions. Another powerhouse for joint health is vitamin C. Most people know vitamin C for its immune-boosting properties, but it's also vital for collagen synthesis. Collagen is the most abundant protein in the body and a key component of cartilage, tendons, and ligaments. As we age, collagen production naturally declines, which can lead to joint deterioration and increased pain. Vitamin C acts as an antioxidant, neutralizing free radicals that can damage cartilage and exacerbate joint pain. Studies have shown that individuals who maintain high vitamin C levels are less likely to develop inflammatory conditions like osteoarthritis. You can boost your vitamin C intake by consuming fruits and vegetables such as oranges, strawberries, kiwi, bell peppers, and spinach. For those who need an extra boost, vitamin C supplements are readily available and generally safe when taken in appropriate doses. Omega-3 fatty acids, while technically not a vitamin, deserve an honorable mention for their impressive anti-inflammatory properties. Found in fatty fish like salmon, mackerel, and sardines, as well as in flax seeds and walnuts, omega-3 SE have been shown to reduce joint pain and stiffness in people with conditions like rheumatoid arthritis. They work by blocking inflammatory cytokines and prostaglandins, chemicals in the body that contribute to pain and swelling. Research suggests that omega-3 supplements can help decrease morning stiffness, tenderness, and the need for pain medication in people with arthritis. When choosing an omega-3 supplement, look for those high in EPA, eicosapentaenoic acid, and DH-adocosahexaenoic acid for maximum benefit. Aim for at least 1,000 mg per day, though higher doses may be recommended for those with chronic joint pain. Incorporating these essential nutrients into your diet can make a significant difference in how your joints feel. However, it's important to note that vitamins and supplements work best as part of a holistic approach to joint health. Regular exercise, weight management, and adequate hydration all play crucial roles in maintaining joint function and reducing pain. Exercise may sound counterintuitive if you're in pain, but gentle, Low-impact activities like swimming, cycling, and walking can help keep joints flexible and reduce stiffness. Strength training exercises that focus on building muscle around the joints can provide additional support, reducing the risk of injury and further pain. Weight management is equally important. Carrying extra body weight puts additional stress on weight-bearing joints like the knees, hips, and lower back. Studies show that losing even a small percentage of body weight can significantly reduce joint pain and improve mobility. Hydration is another often overlooked aspect of joint health. Water helps maintain the lubrication of joints by supporting the production of synovial fluid, the substance that cushions joints during movement. Dehydration can lead to increased friction and discomfort, so drinking plenty of water is essential for joint health. While vitamins and supplements can provide valuable support, it's always best to consult with a healthcare professional before making significant changes to your regimen. This is particularly important for those who are on medications or have underlying health conditions. If you found this information helpful, don't forget to share it with someone who could benefit from it. Hit the like button and subscribe for more tips on living a healthier, pain-free life.